PPT. In last class, we have seen pressure ulcers. Today, we are going to discuss about fungating wound. Fungating wound, otherwise called cancer wound, it is more important section in wound dressing and wound management in palliative care. So many peoples are affected with fungating wound because there is in India, in many places, there is no proper care and treatment, even though there is no cleaning process also for the fungating wound. Because people are thinking, oh, cancer wound is came, so final they will end up with this. So there is no need. There is no need to take care of them like that. Many people are thinking we should destroy that. That's why we are going to discuss the case study also, how we are going to treat the case in directly manner. So before enter the fungating wound, can anyone drop the message what is fungating wound? Can anyone? Okay. I'll start to share. Fungating wound. It is a primary or secondary malignant growth in the skin which has ulcerated and difficult to heal. Again, I am telling it is a primary or secondary malignant growth in the skin. So, skin is got affected with secondary malignant or primary malignant growth. Okay. So, it is difficult to heal. It will shown like a ulcerated wound. Okay. It refers to the malignant process involving both ulceration and proliferative growth. Many wounds in normal diabetic wound, necrotic wound, that will give a definitive structure and that will start to that won't go for ulceration. Okay, but malignant wound definitely go with the ulceration and proliferative growth. Okay, no, it is called as nodular fungus or cauliflower shape. Okay, nodular fungus. So you can clearly see in this picture how it is on like a broccoli, that structure, no, cauliflower structure, small particles like that. Only the fungating wood will be shown. Is it clear for you? What is malignant growth? Please respond, then only I can go with another slide. Because I don't know whether you are listening or not. So please, can you able to understand?
Sorry to interrupt. So you can call someone's name and ask, ma'am. Better.
It's like a school.
Yeah.
Yes.
With them not responding.
Yeah, because it is a main important session. You have to understand that. That's why I'm taking this much level of push. Okay. They someone posted. Yes, Lakshmi, Sanyashi, and Rohini put messages. Okay, we will go to next. Okay, pathophysiology, how the disease is occurring on the skin. Okay. First thing is due to the causes. You know all what are the malignant risk factors and malignant causes. So due to the risk factors, develop non-tender skin nodules. Non-tender skin nodules, like a ball. It will create like a it will develop like a ball like. Okay, that is non-tender skin nodules. Then that leads to enlarged nodules. Okay, that nodule will be enlarged. Okay, then after that, if normal wound means it will go to the next stage. It will like to sound like a erythema like that. Then it will we if we apply on any antibiotic or T-bact, it will calm down. But here, the main thing will be happen, that is disruption of capillaries and lymph vessels. That level deep it will go. Okay, that enlarged nodules will go to the deep level of the skin. So disruption of capillaries and lymph vessels will be affected. Okay, then here obviously capillaries and lymph vessels got affected, so altered coagulation will be happen, then disorganized circulation also happen. Okay, then that will leads to the tissue hypoxia and necrosis. Okay, what is hypoxia? Someone put it in comment or tell.
Lack of oxygen level.
Lack of oxygen level. What is necrosis? What
Like
is
if there's
necrosis?
less blood supply,
Loss of blood supply due to that will leads to cell death. Okay, that is called necrosis. Okay, next, Marjolin's ulcer. In definition itself, I have told some ulceration and proliferative growth will be appeared on the malignant wound. Okay, so ulceration process plus proliferation growth, it will leads to the Marjolin's ulcer. Okay, it is one type of malignant wound. You can see the definition in the slide. Type of malignancy of the skin, malignant changes in a chronic wound. In pathophysiology, pathophysiology, wait. Here we have seen develop non-tender skin nodules. Okay, this is for fungating ulcers, malignant ulcers will start like this way also. Okay, here you have to know the difference. Malignant changes in a chronic wound. That is, already that wound will be developed for some other cause. That chronic wound, that untreated wound will change into the malignant process. Okay, can you able to know the difference? Once the wound will be developed from the nodule, it will disturb the it will disturb the blood capillaries, and it will be ulcerative, and it will give proliferative changes also. Here, chronic wound will be developed as a malignant wound. Okay, you have to know the difference. That's why every chronic things, every chronic pain, chronic inflammation, any teeny chronic pain related or any teeny chronic inflammation will be treated properly. Okay, example, burn scar, pressure ulcer, venous leg ulcer. Okay, some people will get that deep vein thrombosis ulcers, no, that they will think it is for DVT, so there is no need of any other cause. It is caused by diabetic wound, so there where we I am taking diabetic tablets, I am putting betadine every day, so it will cure. Not like that. We have to take a proper treatment for every chronic wound, because there is lots of chance to it will change into a malignant wound. Okay, then pathophysiology for Marjolin's ulcer. Appearance of mass in the wound. You think of, all of you, just imagine one wound, like open wound like that. So in that, appearance of mass in that wound, that is, you have to apply this pathophysiology here. Develop non-tender skin nodule. In that wound, there will be developed thing of appearance of mass. Okay, then onset of wound pain not previously present. Daily we are go through that normal wound. Okay, chronic wound we are daily seeing, but one day the patient may feel deep tendon pain or deep intensive pain on that wound. Okay, that won't previously present. Okay, so then that will leads to change in the character, volume and appearance of drainage. Okay, suddenly the exudate will form. It will come from the wound. Okay, that character of wound will be changed. Shaped wound will be go to the unshaped wound, like cauliflower or broccoli things we have seen in the picture. No, that wound volume also will be increased. Okay, so after the patient have to reach the doctor, they have to do the biopsy of the wound. Okay, this is a pathophysiology of Marjolin's ulcer. Okay, till now we have seen what is fungating wound, what is the different type of fungating wound. Okay, then we have seen both pathophysiologies. Then we are going to discuss about the assessment. Okay, first we need to assess in palliative care. We have to approach in four manner: physical, psychological, spiritual and social. So in physical, the onset of pain will be there, deep pain will be there, exudate drain will be there. Okay, then fever may come. Okay, intensive pain they can feel. Okay, these are all the some of the symptoms on physical management. We have to face the we have to manage those physical symptoms. Then psychologically, first they have anxiety. What happened to me? Here, just a wound, how it will change into the malignancy. Then till for long time it is like it will be there. It was there like a like a small thing, but suddenly you are telling suddenly one day came, then that shape will be changed, the exudate will start to come, was start to come, but how it is changed into the malignancy. So patient may get many questions, many doubtful sessions, then many anxiety. Okay, then they won't believe us first thing, because we are telling for lie, we are telling for money, we are something they blabber. Okay, because psychologically they are getting anxiety. Okay, that have to managed with the proper concern and proper communication. Okay, there is no we should not maintain any collusion. We have to explain in patient language. Okay, accessible language we need to explain to the patient. Okay, then social, if it is started, definitely they will affect with their job, affect with their social norms, their and many things. Okay, that have to manage with our social workers and all. Then spiritual, why God? Always we are in palliative care, we are hearing, why God, why happened to me, why me, is it a punishment, why me, like that they developing many questions. We have to manage them with the proper spiritual answers. If we can't able to answer for their question, we have to do the active listening to the patients. Okay, we should not give hope, and you don't tell, you see that patient, you see this patient, you see down people, then you, like that you should not preach them. They have to attended by their priest, their religious priest. They can speak through their holy bible, holy gita or holy quran, like that. Their you have to approach that religious priest, which is give confidence to the patient, to manage the spiritual pain. Okay, so these type of problems patients going to face in malignant tumor. First, in physical, I'm telling, in physical they are going to meet a pain, exudate, drainage, and intensive pain. That's all. Psychological fear, anxiety, then social, they may lose job, they may lose their potential to do activities like that. Then spiritually, why me, self guilt, those things will occur in spiritual problems. Okay, here you can see in explanation, physical pain, malodor, bleeding, exudates, itching, infestations with maggots. What is the meaning of maggots? Can anyone say what is the meaning of maggots? I am going to tell the name.
It's like kind of worm that affects the wound.
It is like a worm. Okay, how it is coming? How it is appearing? Okay, I'll explain later. Type of larva. Okay, Sagar Sarma replied, type of larva. Okay, yes, it is type of worms infestations, but I'll tell afterwards. Okay, then final on communication difficulties. Okay, if the fungating ulcer or fungating wound appeared on the skin means they can't speak well. It is. Then psychological problems, altered body image, sexuality, denial, fear, depression, anxiety, shame, and guilt. Okay. Then social, family isolation. Here, other difference between the other wound, they may go with family isolation. Then social isolation, social stigma, and fear of contagion. Contagion. Okay, the family isolation means the wound will give some disturbed vision to the other person. Okay, so it is not like a normal wound. We have seen the picture, then we in your hospitals and in your studies you have seen many patients. That wound will give some discomfort to the visitors or others. Okay, so they due to the discomfort, some family members make that isolation. Okay, then that will leads to the social isolation. Then social stigma, fear of contagion. Oh, it will spread to me. Whether it will it will spread to me, it will spread to others, it will spread, it will cause harm to babies, it will cause harm to me, like that they will think. Okay, then effects on family, effects on sexual relationship, marital disharmony will happen. Some of the partners will not take us a will not give a proper care to their partner. They will think they will it will that fungating wound, it will give a discomfort image. Then they will lose interest on the partner, some of them. Then okay, spiritual, interference with religious rites, punishment from God, fear of impending death. So when they are developed with a chronic disease which is not which is affected their quality of life, many people think it is a punishment of God, punishment from God. Okay, so we are doing some interferences with our religious rights, so it came to me, so God give to me. Then so in society some of the people will speak about the person. He did something, she did something, so God punished me, so we should not talk to her, we should not talk to him, we should not interfere with any spiritual activities, like that. They will give a punishment to the affected persons. Okay, then patient may feel fear of impending death. Oh, I'll death tomorrow, I'll die tomorrow. In early stages of chronic illnesses, patient first they may feel denial, anger, depression. They can't able to accept. Okay, so fear of impending death, fear of seeing them in the mirror, then fear of already they may experienced with the family isolation, social isolation. So these things give a more depression and more stress on the patient. Okay. Okay, first we need to the assessment. In every patient, if you are going to attend any patient, first you have to do assessments. Okay, it have to start with the history collection. First you have to give self introduction to the patient. Then you have to ask the patient whether he is ready, whether he is comfortable at the time to do the procedures or to do the other things. Okay, you have to ask that. Then you have to ask the history collection. Okay, then after that you have to do the assessment. Okay, first thing you have to do wound location. Okay, mobility impaired, easily covered with public review. Okay, mobility impaired. Wound, when you are checking for wound location, that mobility should be impaired. Then we have to give some privacy to the patient from the public. Okay, then you have to check whether it is showing on the easily covered place or not. It is I'm telling like it is if it is appeared on the skin means he can't cover. Okay, it is appeared on the mouth, it is appeared on the skin or any other visible parts means they can't cover. Okay, so here their guilt feel will be improved, will be increased, then isolation will be started from there. Okay, so check that first. Okay, it is in visible area or not. Okay, then mobility impaired means if it is in neck region means they can't able to do mobilization. Okay, if it is in wrist area means they can't do mobilization. So these assessments you have to know first. Okay, then wound appearance, how the it is it a starting stage or is it a Magellan's ulcer or it is go with a secondary growth. Those things you have to observe in wound appearance. Then surrounding skin, so if it is the skin is the wound is affecting here means you have to check the surrounding skin also. Okay, then potential for complications, potential for obstruction or hemorrhage from major blood vessels. If the wound is appeared on the neck area means here which vein is going, main important vein is going jugular vein. Okay, if the hemorrhage, if the wound will be proliferated means the vein also will be affected. Okay, blood vessels also will be affected. So like that you have to check the potential for obstruction or hemorrhage from major blood vessels. Okay, then principles of management you can see here. Palliation of symptoms. Okay, so here to see here I'm sharing one thing. If you are seeing this type of wound on the patient, okay, so how you will do the wound and pain assessment? So first I have told about the wound location. Where it is located, this wound where it is located. Now we are going to do the pain assessment where the wound is located. Is it visible area? Participants, please answer. Subclavian area. Yes. But it is right side on the patient. Okay. In this, you have to check first appearance and shape. How it is the shape? Wound appearance. Before that, can we cover it from public view? Can we cover it from public view? Kiran, can you answer for this? Kiran, I'm just asking. I have told for assessment, wound location, wound appearance, like that. No one is telling.
Ma'am, someone is saying it's Lakshmi Sanyasi.
Yes, she is only responding, and 3 people are.
Anita.
Yeah, yes, covered.
Yeah.
Yes, okay. That Kiran didn't answer to me. Hannah, note that.
Sure, ma'am.
Okay.
Participant, please reply to the question.
Then, how about the surrounding area? How it is showing? Surrounding area. Surrounding skin. What about surrounding skin? From next class, I'm going to tell all of you on your video. Neetu Rani, can you tell? Randomly, I'm telling names. Arm area is visible. Then Neetu Rani, can you tell how is the surrounding area of the wound? Are you people listening?
Yes, ma'am. Yeah, listening, ma'am.
Okay. Someone finally send answer. Here you can see the surrounding skin. You can see the small nodules around the wound. Okay. Some rashes, like some erythema, like pimples, like things happening to the surrounding of the affected wound area. Then potential for complication. Is there any complication will be occurred? Like I have told you, no, that is destruction of any blood major vessels, like that. Disruption of any main major blood vessels, main capillaries, like that. Is there
Ma'am,
any
lymph
possibility?
possibility of blockage of lymph
Yeah,
because their
possibility of,
nodules are present, no?
yes, yes. Possibilities there to blocking the nodules and lymph nodes, other than the wound is deep. So this wound is deep and it is near to the axillary area. So in our upper part of the body, many lymph nodes are stored near to the axillary area. So here the patient is having, there is decreased possibility of affected with the, it is also suppressed inferior vena cava. Yes, but is, yes, correct. Then suppression of inferior vena, the blood major vessel will be affected. Then lymph nodes, most of the lymph nodes will be affected. So it will leads to the, it will, what will happen if lymph nodes affected means lymph node drainage will not be happen. So lymphedema, in high risk of lymphedema, then that lymphedema will go to the pneumothorax. Okay, will be developed as a, there is many chance to pneumothorax. Okay. Okay. So here, wound location, right breast, size 15 centimeter by 10 centimeter, exudate, minimal and some bleeding was there. So assessment tool used time framework. Okay, Kiran, okay, listen. Then assessment, wound location, wound appearance, surrounding skin, potential for complications, and other things. Do inspection. Those things we have to do with the assessment tools. Then the tissue is necrotic and slough. Okay, infection and inflammation is present. Moisture is here balanced. That edge, wound edges are irregular. It is like a rolled bread, a rolled bun, like that. Okay, so patient is having pain, pain is number 6 in pain scale, numerical rating scale. Pain is 6. Okay. In psychosocial assessment, PCOC. What is PCOC in psychosocial assessment? What is the meaning of PCOC? What is the meaning of PCOC in psychosocial assessment? It is mandatory to know in the palliative.
No idea, ma'am. Can you explain that?
No idea. Anyone?
Ma'am, something like paracystic.
Paracystic. No, it is in psychosocial.
Okay, ma'am.
Patient is female patient. Right breast is affecting. Psychosocial assessment is PCOC. Yes. Someone answered polycystic. Good. Very good. Name. Who is that? Chewang Ihamu. Good.
Ma'am, maybe polycystic ovarian cancer, like.
Yes.
Okay.
You have to know this terms and all. Okay. Then it will be easy for you. Okay. Then now, again, here go with previous slide. Okay. So here we have seen assessment and all. Now we are entering into the principles of management. Okay. First, palliation of symptoms. Okay. Before all of you nurses know here, all of you nurses, any other people are there, doctors or all of you nurses know here. Any social workers? Okay. Okay. First, if you are all of you, I hope all of you familiar with the word nursing diagnosis. Am I right? Nursing diagnosis.
Yes, ma'am.
Yes. 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 So in nursing diagnosis, the patient diagnosis is different. Our nursing diagnosis is different. Okay. Disease diagnosis is patient is having breast cancer or any cancer, anything like that. But in nursing diagnosis, we have to put the priority to manage the symptoms. Okay, we have to give prioritization on the symptomatic management. Okay, if a patient is having more pain, he is having hyperthermia, he is having hyperthermia and he is having fluid volume deficit. Which one we will treat first? Whether fluid volume deficit or hyperthermia or a pain, intensive pain. Which one we will treat first? Which thing we need to give? Hypothermia, Lakshmi Sanyashi. Is it right? Patient is having more intensive pain. Okay. Then patient is having fluid volume deficit. Then patient is having fever also, that is hyperthermia. 1 or 2 is having. Patient diagnosis appendicitis means what you will treat first? Renu, first pain. Yes, you are right. We have to give importance in pain. Okay, the pain, you have to ask the pain first. Pain scale you have to ask. Okay, pain assessment you have to do. Then, if the pain is more than 3,
गंगापुर से थोड़े बड़े पोस्ट ऑफिस से मतलब 2 मोड़ आगे
हाँ
जैसे
मंदिर दाढ़े हैं
जहाँ को
sorry.
और मंदिर में जाके आई
अच्छा मैं ਇੱਥੇ ਗਏ
Jyoti, can you mute your
आपके पास तो अभी हाँ
Jyoti, can you mute? See, listen. In numerical pain scale, if you are having 3, the pain score is 3. Okay, you have to treat the pain first. Okay, then you have to additionally have to treat the hypothermia. Okay, then next only you have to go with the fluid volume deficit and other thing. The patient is having breathing difficulty, then with the pain. In this case also, you have to treat the pain first. Okay, additional supplements you can give. But in any case, because pain also leads to the breathing difficulty. Okay, so what are the cause for breath? You have to assess what are the cause for breathing difficulty, how the intense of pain, where it is, what is precipitating the pain. Those things you have to assess within a minute. Then you have to start. You have to prioritize your nursing care plans. Okay, so here also the same palliation of symptoms, reducing pain. First, you have to reduce the pain. Okay, many people are will think you if you are entering into the patient room or home care means, many people are doing the mistake. They will start to controlling order and they will start to drain out the exudate and all. They will directly go with the person. Already patient is in pain. Okay, then patient won't give any cooperation. Okay, then if you are touch the wound with the high level of pain means the patient pain will be increased. This will lead to the complications related to the pain attacks, panic attacks, shock also patient may go. Okay, so we have to first do the step reducing the pain. Okay, then second step is controlling odor and infection. Okay, in previous class we have seen how to control odor. Okay, how to control odor? How to control odor? I told one method, easy method to control odor on the particular affected area. What is that? Easy method, I think. Did anyone? Don't you remember about charcoal?
Yes, ma'am.
Mm.
Yes, ma'am.
Mm. You are forgetting in next class itself. Then how will you give treatment to the patients after the sessions? Don't forget about charcoal, okay? Okay. First, you have to control the odor. Then you have to manage the exudate, that is drainage from the wound, no, that have to be managed. Okay. Then you will go to the infection control that measures. Okay. Here, wound care plan, you can see first, gentle normal saline. You have to clean the wound with the gentle normal saline. If the wound is more proliferated and ulcerated, if it is a Majoline ulcer, means you can give the antimicrobial rinse. It is a this wound care plan is for WHO. Singapore people are maintaining this wound care plan. In India, we are doing with the metronidazole pill. Okay, you have to crush that pill. Okay, then with that you can flush up with the normal saline. Then you have to wash the wound area. Then all of you aware of that nebulization kit, no? Nebulizer kit, nebulization kit. All of you aware, no? Yes. With that help of nebulization kit, you can use the metronidazole pill. You just apply the that like how we are applying salbutamol to the mouth, no, you have to remove that mask. That on pressure pipe, through that pressure pipe on air will come. That when you are switch on the nebulizer, the pressure air will come. So you have to apply on that pressure on the wound. Okay, so that is one type of cleaning method, that is an effective method that will helps to remove the odor and infection. Okay, then dressing regimen, primary dressing and secondary regimen. Secondary dressing is there. Primary dressing, charcoal or silver dressing for odor and infection control. Here in Singapore, they are applying directly, but here we are using metronidazole. Okay, in that I have told you now that nebulizing method, we just we can apply that metronidazole, then or we can apply the metronidazole powder mixing with the normal saline over the wound area. Then secondary dressing, super absorbent foam or sanitary pads we can use okay, because more exudates we can expect from the patient wound. Okay, we can use the sanitary napkins, it will be cost effective in home care, in palliative, so we can use that also for the secondary dressing. Okay, then adjacent, crush the metronidazole tablet sprinkled onto the wound to mask odor. Okay, so before I have told you, no, we can put on the sprinkled tablets on the wound to mask order to prevent infections. Okay. So silver dressing in some palliative homes are using silver dressing. Any of you using silver dressing for malignant wound here? Many of you from other places know if anyone is using silver dressing. Then what type of dressing you will use for fungating ulcers in your place? In many places, they bring advised ointments. They bring their advised ointments bitter in. Oh, okay, then. Okay, some of them some of them described with prescribed with tea backed and povidone iodine. Yes, they will come with that. Tea backed ointment. Yes, yes, they will come. Neosporin ointment. They will come with that antimicrobial creams. Okay, but silver dressing neomycin. Okay, good. Okay. Mostly they will use neomycin, that is neosporin, then tea backed and povidone iodine ointment. They will come with that. So here you have to what they are bringing to you. Is it available? Means you can use that. Then additionally you have to go to the metronidazole. But metronidazole giving a it will give a great result on odor control. Okay, if you are applying the method of nebulization method, if you are applying means it will be giving it is giving a most effective control to the infection as well as the malodor. Then you have to use the charcoal. Okay, put the charcoal under the bed of the patient. It also control the odor on the environment. Okay. Okay, for ma'am, it is bleeding. What we have to do? You have to use the adrenaline pack. Okay, 1 ml adrenaline dilutes 9 ml of normal saline. Here you have to know adrenaline pack. Okay, you have to use like a pack to stop the bleeding. Okay, you have to dip on the gauze, sterile gauze, and you have to apply on the bleeding area. Okay, this is the wound care plan. Here you can see the adrenaline pack. So this is silver dressing. This is charcoal dressing. This is silver dressing. This is charcoal dressing. This is one antibiotic, protonzol. Okay, we will go to the next one. Any doubts till now? Okay, here we are going to now till now we have seen dressing methods. Here we are going to minimizing the pain. Okay, first we need to do the assessment in pain, deep pain. You have to ask aching pain or stabbing pain or continuous pain. Okay, then adjusting systematic analgesics. Okay, it have to start before the dressing. Okay, it should be start. Okay, adjusting systemic analgesics you can give with the prescribed doctor prescription. You can start with the pain minimizing pain control. Then superficial pain, burning pain, pricking pain means you can use the sensorkine or lignocaine to manage the burning or pricking pain. Okay, local applications you can use. Okay. Okay, all order. So here, bleeding, you have to prevention. Then we have seen in the previous dressing care plan that adrenaline pack we can give, then apply local pressure. Then sucralfate powder also will help with this. Tranexamic acid, that's also will help that. Systemic ethamsilate. These are the powder formats or ointment formats. It will help to stop the bleeding, but adrenaline pack will help most effectively. Okay. Then if it is bleeding is not stopped, it is more day by day, it is increasing more by more, means you have to go for the palliative radiotherapy. Okay. Here, role of cancer therapy, which are all available for fungating ulcer, radiotherapy, cytotoxic chemotherapy, hormone therapy, and surgery. If it is affected with major blood vessels, means they will definitely go with the surgical treatment plan. Okay. Next important matter came maggots. Okay. The worm infestation on the open wound. Okay. So here, the open affected wound will got infection with the worms, that is called maggots. If any flies or mosquitoes sit on the latching on the wound, means these larvae like maggots will happening. So we have to maintain the safety environment. We have to advise the caretaker to maintain the safe and clean hygienic environment to the patient. Okay. Any tiny small mosquitoes, any tiny small flies sitting on the wound, means it will start to latching, means the maggots will appear within the 3 to 6 hours. Okay. So we have to very careful for the maggots. So how to remove this? We should not do the physical removal in forcefully. So because many blood capillaries or blood vessels will be affected. So what we have to do means we have to apply turpentine. Okay. We have to soak the turpentine with the help of cotton piece or gauze piece. We have to uh, make that gauze or a cloth piece which is dipped with the turpentine. You have to show near to the wound, not we should not apply on the wound, just you have to hold near to the wound. So with that smell, all that maggots will be started to come out. Okay. Okay. Then you can do the physical removal. Okay. But repeatedly you have to do with the turpentine soaked gauze method. Okay. Wound should be covered with the dressing all time and changed daily. It should be covered and it should be changed daily. Okay. So that's all. Today we have seen what is fungating ulcer, what is Majoline ulcer, how what are the problems they may face, then how we should treat them, then how we should give proper dressing. These things, what is maggots, how we need to control those things we have seen. Okay. Any doubts till now? So here we have to maintain some ethical consideration when you are treating with the patient of fungating ulcer. Avoid unnecessary interventions. Okay. Respect patient wishes and dignity. Be culturally sensitive. So this is the major ethical consideration who are going to deal with the patient of uh, fungating ulcer. This is a holistic assessment, holistic approach. Patient and care. Here you have to address. You should address the caregivers also in home care setting, because they are living with the discomfort. Okay, with the malodor, then loved ones got affected. So we have to address their problems also in holistic assessment. Caregiver, you have to know the caregivers fears and competency. You have to know. Okay, how uh, they will get fear whether it is contagious to me. So you have to clearly tell it is not a contagious. Then you have to give the awareness of the wound. You have to educate to, you have to educate to the patients about the dressing, wound dressing education. Step by step you have to educate. You have to assess first. You have to assess them first. You have to sit with them. You have to you people have to work together in initial stage. Okay, then level of coping. You have to assess the level of coping. Okay, you have to consider their age and competency, then coping level, knowledge level. You have to assess those things also. Then only you have to assess, and you have to tell them clearly according to their competency and coping level. Because if the category is 16 years old, old girl means her coping level is different from comparatively to the 40 years old. So so coping level strategy also here more important. Okay, then financial issues. Okay, financial issues can be solved with the help of NGOs or near volunteers. Okay, then fear of morphine, body image issues. If the patient is having a chronic wound, it will turn into the malignancy, or if any malignant conditions, patients may have fear of morphine. If they are taking morphine for their pain, they will think whether I'll go with the addiction, like that. So you have to clearly tell none of those things will not happen. This morphine for their good thing. Okay, those things you have to clear. You have to teach them about that. Okay, body image issues they feel. Okay, so that also should be addressed in a right manner. Then many fungating ulcer patients in visible area affected patients, many of them in the suicidal tendency. So we are the responsible persons for that to prevent suicidal tendencies. Okay, so we are in the responsible position. So multidisciplinary approach. You have to teach them, and you have to support them. You have to address each and every notes from the patient and the caregiver. Okay, so here from so today my session is over. Any doubts you can ask.
Dear participant, please ask your doubts. Ma'am is with us.
Is it clear for you all? I'm not asking questions. Is it clear or not? Any doubts, please ask.
Ma'am, actually, we sometimes we use this hydrogen peroxide for maggots. Is it like
No,
appropriate?
no. No, we should not use hydrogen peroxide, because blood vessels will be ruptured. Okay, then that's why we need to use turpentine. Many of them used hydrogen peroxide. See, you know the difference why we are using hydrogen peroxide for dressing. Okay, here betadine liquid also we are using for dressing, and hydrogen peroxide for also we are using dressing. Here you have to know the difference. Hydrogen peroxide is used for non-oxygenated things. That is how I if you are if someone is getting accident, okay, he fall down on the roadside, so teeny glass pieces or sand, it is not having oxygens, okay, am I right? It is not a microorganisms, okay. It will be removed by the hydrogen peroxide, okay. Then who is getting oxygen? That is microorganisms, who is living organisms, okay. This is, it will be the correct answer. Who is getting living organisms will be removed with the betadine wash, okay. A hydrogen peroxide wash is used for non-living things, should be removed with the removed from the wound. Now you can get your point, I think so. That's why we should not use hydrogen peroxide.
Ma'am, like you mean like anaerobic or aerobic?
Yes. Aerobic microorganisms removed with the betadine, and anaerobic organisms or things will be removed with the hydrogen peroxide. Here, maggots are uh, coming from larva, which is not sided to us. Okay, it is from the flies. It is from the flies. So some orders, heavy orders will be removed. So turpentine will help us to remove the maggots. You directly, you don't force the forcefully don't rush into the with the forceps, you don't rush, okay, to remove the maggots in physical manner. Just soak and show near to the wound, all maggots will started to come out. Next, any doubts? Are you clear?
Yes, ma'am. Yes, thank you.
Any doubts? How was the class today? Please tell for this too.
Ma'am, the sessions are very informative and they are really helping us to know things that we can't even think that it's so deep that we can apply it wherever we are working. So I think the sessions, all sessions are good, and the wound management, everything, the types of wounds, to get to know about what things we have to include. So it was very informative and highly, yeah, knowledgeable. So thank you so much.
Thank you so much. Thank you so much. So please apply every thing you are learning in Pallium courses. It is very valuable. It is sometimes some methods people are not afford with the other medications or many things, but there are cost effective methods also available. So you are learning definitely from Pallium India. It will definitely help you and your patient also. God bless you all. Thank you so much. Go high and make a huge change in palliative and the other health activities. Thank you. Thank you all.
Thank you, ma'am.
Thank you, Hannah. Thank you so much.
Thank you for your insightful session, and it is really interactive. Okay.
Yes.
Yeah. Thank you, ma'am.
Thank you, Sparsh. Thank you so much. God bless you. Thank you.
Bye, ma'am. So, thank you for all participants, and we can wrap up for today. So, see you all for the next session. You can leave now. And a gentle reminder, tomorrow is the
Not audible, ma'am. You're not audible.
sorry.
आवाज नहीं आ रही थी मैम.
Okay. So tomorrow will be the last day for submitting the assignment too. So please submit your assignment. Okay.